Well, thank you, everyone. Wow, just wow. This has been an absolutely incredible day with incredible focus on health workers and why health workers matter so much. We started the day with the Community Health Impact Coalition event this morning, where we heard from many, many health workers, and then today again. So my first thank you is actually to all of the health workers throughout the entire world who are standing there every single day, caring there for communities and ensuring that health care gets everywhere. So thank you, thank you, thank you. And thank you for sharing with us today your challenges, the conditions, the things that make you not able to do the job that you'd really like to do. And thank you for telling us what we need to do, what you need, and how we can support you. So thank you. I also know there were many people here engaged in working to identify and partner with many of the health workers that are here today, brought them all the way to New York so that we could sit together and listen to you, Mothers to Mother, Sabin Vaccine Institute, Women Deliver, all of you, and the rest of the coalition, of Frontline Health Worker Coalitions, all engaged in supporting the health workforces throughout the world. Thank you for all of your continued support. Also to the Honorable Minister of Health from Tanzania, Burkina Faso, thank you very much for your leadership and to your commitment in your countries and beyond to support the health workforce for the health of your communities and beyond. Thank you for your leadership and for inspiring us all today. Next, I want to thank the audience. All of you are here today because you're invested in this effort. So I want to thank you for being here and to get together to listen to these people, to listen to all of our panelists, to talk about the challenges, the sobering statistics, and how we can together spark a global movement. So thank you all for being here. Many co-sponsors of the event, the stakeholders, policymakers, donors, government leaders, especially I want to thank Crystal Landers and Pathfinder, who was the vision behind this, but really the entire Frontline Health Worker Coalition for bringing this together. Next, I want to talk a little bit about our keynote speaker, Dr. Ayode. She was here to give us a spark. And I think she gave me a spark, and I think she gave all of us a spark today. She made us take a very hard look at the progress, or lack thereof, that we've made over the past several decades. She gave us statistics on the shortage of healthcare workers that were not paid, let alone on time, that health workers are not paid and not protected. It's a very stark situation. And I loved it when she said, those of us who wear the shoes know where it hurts. So many of us here today don't know where it really hurts. So thank you again to the healthcare workers for helping us know where it hurts and how we can support you better. Today, Dr. Ahmed from the Africa CDC, he said that talking is good, but talking only is bad. And so I want to challenge us all here today. We've done a lot of talking, we've done a lot of listening. So we need to make sure this is not a talking-only situation. I was so struck when Atul Gawande from USAID said that USAID has made a promise for 40 years to make further investments in primary health care globally. 40 years. Let's not wait another 40 years to take action on what we learned today. Let's all commit today that we're going to do something very, very different. Dr. Gawande challenged all of us. He said, we need to advocate. He's saying in Congress right now, there isn't support. And for many donors, there isn't enough support for the healthcare workforce. So we need to continue to advocate, to provide the evidence that we need so that we can go to stakeholders and increase our investments in the workforce. I'm glad that we end on a note of partnership because there are many hopeful partners and people that are investing in supporting the health workforce. So thanks to these, real examples to us all of how we can ensure that it's not another 40 years. So thank you, all of you. I also want to invite everyone to stay after for a reception, where we're going to hear from some of the founders of the Frontline Health Workers Coalition, who have done so much over the years to raise the issue of investing in the healthcare workforce and what we can do for this critical effort. So thank you all for a great day, and please stay with us as we move to reception.